cannabis can be very effective in treating lung cancer. There are many different types of lung cancers, and each one is treated differently. We recommend that you start with a 1-to-2 ratio of THC to CBD, and you increase from there as quickly as you're able to do. Oftentimes, people find that immediately they'll start having increased wellness, they'll feel better, the side effects of any other treatments are mitigated by using the cannabinoid therapies along with it, and it can stop the progression of the metastasis from the lung cancers, which oftentimes go to the brain. The receptors within your organs, within your lungs, are numerous, and so we have a lot to target within the lungs when treating lung cancer. So it is actually one of the ones that we have tremendous results with. And interestingly enough, we have better results using cannabis in treating lung cancer than the numbers that are traditionally associated with the survival rates of lung cancer patients just using traditional allopathic medicines. If you're going through chemotherapy with lung cancer, you're going to want to use cannabis absolutely at the same time. Oftentimes, people also have extreme levels of radiation, and they end up with things like radiation pneumonitis and severe skin burns from the radiation. And the topicals can be extremely effective with the skin burning, and also the ingestion of the cannabinoids can help to mitigate some of the side effects of the radiation pneumonitis, which can be the side effects of the cancer, which can be more detrimental than the cancer itself in many cases. So yes, cannabis is a very effective first-line treatment for lung cancer. We do not recommend that you do it instead without having a really important conversation with your doctor guiding you. Now, if you come from a place where your doctors know nothing about cannabis, their first thing is going to be no. So you may have to make the decision to seek out a doctor in a location that does understand cannabis, who will work effectively with you along with your oncologist to come up with the best plan of treatment for you. Cannabis is an excellent, excellent first-line treatment though, and I think that you will find that by using it, you can tolerate other treatments much more effectively, and that you'll have greater outcomes than you would without it, and have a much more hopeful outlook on life, because it actually does make you happier. It does make you happier. Now, I want to say, you want to make sure, though, that you also are eliminating any sugars from your diet. Anything that metabolizes into glucose, you're going to want to be careful with because of the feeding the cancer cells with the glucose, especially in lung cancer. That's very, very important. I'm asked on a regular basis if you can smoke cannabis while you have lung cancer, or is it good for it, is it bad for it? And the studies show that there is no evidence that there's an increase in lung cancer. In fact, there's a decrease in lung cancer among people who smoke cannabis. We have a very complicated world we're living in right now, with people using pesticides and all sorts of other mycotoxins that are appearing in the medicine. So you have to be very, very careful, because the cannabinoids and the terpenes that are actually the cannabis plant are great, but you want to make sure that it's very clean medicine. If you are in fact going to smoke it, you've got to see lab results and trust that those lab results are accurate in showing pesticides, microbials, aflatoxins, etc. Because those things are not good for your lungs. So you don't want to, at the same time that you're putting something good in, put something bad. I would suggest that if you want to use, you want to smoke along with your other treatments, because you cannot get to a therapeutic dose from smoking. You must ingest it, in addition to smoking, that you use something that's at a very, very low temperature, a vaporizer at the lowest temperature that you can get it to vaporize, and that also that you make sure that you start out with extremely clean flowers or oils, and that is where you have to look at the lab results. Now, does cannabis cure lung cancer? I cannot stress enough that there is no such thing as a cure for cancer. Cannabis can put you into remission. Cannabis can help other treatments work much more effectively. Cannabis can also help with all the side effects that you're going to experience as a result of your other treatments. You may have to stay on the cannabis, though, for the rest of your life. Not in the same doses that you have to use to get rid of the cancer, but we have found that when people stop using it, even after several years, that the cancer cells can come back. That's the same thing, though, with any other treatment. Because there is no cure, it is a chronic systemic disease. However, you can live a very normal, productive life on the low doses that you would be required for maintenance treatment of lung cancer. So no cure, but long-term hope and long-term survival.